Hi, let us read about complications associated with corticosteroid therapy. Whenever a patient begins a course of corticosteroid therapy, the potential for complications is great. Dosing regimens vary widely depending on the underlying hematologic condition and the patient's response to the medication. For example, several chemotherapy protocols include high doses of corticosteroids for a period of several days. After that time, the medication is stopped abruptly without tapering the dosage. In other conditions, such as idiopathic thrombocytopenic purpura or hemolytic anemias, the corticosteroids are very carefully tapered to prevent a flare-up of the underlying disease. With the exception of patients with pre-existing conditions such as diabetes, hypertension, and osteoporosis, it is difficult to predict which complications will occur in a given patient. Patients who receive high doses of corticosteroids for longer than a few weeks should be screened for symptoms related to the potential complications listed down. If at all possible, patients who require long-term corticosteroid use should be switched to an alternative day dosing schedule. This method may diminish the severity of complications that arise. Short-term complications, fluid and electrolyte complications. Under this, fluid retention, sodium retention, potassium loss, hypokalemic alkalosis, hypertension. Second, endocrine complications. Under this, decreased carbohydrate tolerance, diabetes mellitus, uncontrolled glucose level in diabetes mellitus. Third one, neurologic complications, headache. Fourth, musculoskeletal complications, muscle weakness. Fifth, psychological complications, depression, euphoria, mood swings, insomnia, psychosis. And long-term complications are endocrine complications, decreased adrenocortical activity, decreased ability to respond to stress, decreased carbohydrate tolerance, decreased growth rate, especially in children, Cushingoid state, menstrual irregularities, increased sweating. And second one, metabolic complications, in that protein catabolism causing negative nitrogen balance. Third, gastrointestinal complications, gastritis, ulcerative esophagitis, peptic ulcer, pancreatitis. Fourth one, musculoskeletal complications, decreased muscle mass, osteoporosis, vertebral compression fracture, pathologic fracture, aseptic necrosis of femoral and humeral heads. Fifth, neurologic complications. Under this, vertigo, increased intracranial pressure, seizures. Sixth, ophthalmic complications, cataract formation, glaucoma, exophthalmos. Seventh, dermatologic complications, impaired wound healing, ecchymosis, increased skin fragility, decreased skin thickness, petechiae. And the last one, immunologic complications, decreased response to infection, masked signs of early stages of infection, suppressed reaction to skin test, and increased risk for opportunistic infection. Thank you.